that they made to get gram positives and some gram negatives, like E. coli. Made it a little more broad spectrum. Well, they are also discovering that bacteria are becoming resistant to penicillin. The gram-positive bacteria aren't responding to penicillin as well as they used to. So they took that back in the lab and they altered it again and made methicillin. So methicillin was made to address the antibiotic resistance of penicillin. And now, look what happens. It evolves resistance to methicillin. So after methicillin, they were like, well, crap, now what do we do? Then they started using vancomycin. So then we got somebody who's resistant to vancomycin. So it's they call it the arms race. I hit you with a stick, you shoot me with a gun. I drop a bomb on you. Whatever. It just keeps getting worse and worse, you know.
Like a bacteria, they know what kind of...
They evolve. Exactly. They evolve faster than we do because they can replicate. They have a generation every 20 minutes. We have a generation every 25 years. So they evolve faster than we do. So they learn as a matter of saying. They learn. It's not really learning. It's evolving. Okay. So what they theorize happened is, remember conjugation?
Yes.
Bacterial species can swap a plasmid. If the plasmid carries antibiotic resistance, and some of these bacteria in the body conjugate with some of these bacteria in the body, what happens is these acquire the other way around. These acquire the vancomycin resistant gene, and what do you end up with? Versa. Now you have vancomycin resistant Staph aureus. There's also visa. So it kind of went first visa, this is intermediate. So when it comes to resistance, it's not black or white. Some bacteria are more resistant, some bacteria are less resistant. It's not resistant and not at all resistant. There's a degree, it's a range. So first in their evolution, they got stronger and stronger. We called them visa. And eventually, when we're dosing up a patient with vancomycin and they're not responding, even at high doses for an extended period, then we decide it's resistant. It's not just intermediate, it's resistant. It's versa. So the problem is here, Staph aureus is more pathogenic. Enterococcus fecalis or faecium, it's normal flora, everybody has it in their bowels, and it's not particularly pathogenic. It can cause opportunistic infections if it's a infection wound or something, but usually your immune system can take care of it. If you're an immunocompromised person in the hospital, however, your immune system might not be able to take care of it. And you're probably receiving antibiotics because you're in the hospital for some reason, and so it just gets stronger and stronger and stronger, and then when it meets Staph aureus, conveys its vancomycin resistant to the more pathogenic bacteria. So versa is the worst possible scenario because vancomycin is our stronger antibiotic. So it's resistant to a stronger antibiotic, and the bacterium is more pathogenic. So that's the worst possible combination. You had a relatively non-pathogenic organism that was resistant to our strongest antibiotic. Now you have a more pathogenic organism that's resistant to our strongest antibiotic. So anyway, those two are E and S. Now let's look at what K is.
Question.
Yep.
Did anybody get rid of Versa?
No, it's still out there.
No, I mean, if you get Versa, is it possible to get, I don't know, out of your system?
Yes, you'd probably have to take a cocktail, a combination of different antibiotics that work with synergistic effects. So it's not just gonna beat it with a stick, it's also gonna shoot it with a gun and drop a bomb on it, all at the same time. But a lot of times, patients that get these are immunocompromised patients. And sometimes, just giving them that much drug is enough to kill them off because they're so weak anyway.
So this is gonna die one way or
Another
another.
swab test to see if it was still in the system, and it wasn't. So I was able to get like piercings, so I was getting it from.
So what did you take to get rid of the MRSA?
It was just something I had out.
Oh, yeah.
Yeah, but that was to get rid of it, because I had it for a time.
How to get rid of it on your skin?
Yeah, and
How to
then,
get rid of it here?
I don't know, they took a nose swab test to see if it was still in my system, and my doctor said it wasn't.
It could be a false negative too, though, like for us, we have to
Well, it
do two
was.
screens before we can, but normally the colonization is in the back of the nares, if you don't.
Get the swab right up in there?
Yeah, but I wasn't able to get piercings, I would get MRSA right away, because it was an open wound, and then after she said it was okay, I got piercings and it was fine. So, it didn't happen anymore.
Maybe not quite the clinical level where it's detectable.
Maybe your immune system got stronger. Maybe when you picked it up, you were having a problem, and that's why you picked it up. When your immune system got stronger, you got rid of it.
They always said that if when you have it, once it's in your system, you can get rid of it.
Oh, yeah, you can, because they've done it. They, one hospital, sorry to say, in Pittsburgh, but it wasn't the one you told me about in Pittsburgh. It was the medical teaching hospital in Pittsburgh.
There's a lot of UPMC.
Yeah, way up high on the mountain there.
UPMC.
So what they did was they took all the healthcare workers, tested them for MRSA in their nares. Anybody who tested positive, they made them stay home and take a dose of antibiotics until they tested negative. So the antibiotics, if you take the right kind of antibiotic, it can get rid of it in your system. But keep in mind, this is probably someone who's otherwise relatively healthy.
Yeah, I was young when I had it, I was in middle school.
Yeah.
I was actually by high
Yeah.
school.
I think your immune system actually grew up.
Yeah, that's what they thought.
Because when you're young, you're more susceptible to stuff.
There's a difference between having MRSA and having it in your
Right.
system.
Right,
Because
so
I
you can
had
be
it,
colonized
but I was
with
never
it,
a carrier.
or you can have an infection.
I never had it systemic, so I had it, but I
And
never had it.
probably most people have Staph aureus in your nares. Staph aureus that's MRSA could also be there. So,
If you had a cut on your stomach or something and then it got into it, because my ex-husband got MRSA, or he said he did, and he was in the hospital for a while, and he said it was almost gonna kill him. So if he had an open wound,
yeah, probably
that's how it
ended
probably got in there?
it could be, or in her case, she was colonized with it. Had you been in the hospital before that happened?
They didn't know what it was at first, but they said every time I went in the hot tub, when I had a cut or a mosquito bite, it was
MRSA's in the community, that's the thing, it's not just in the hospital, it's in the community. He could be colonized with it, and usually if you are and you get immunocompromised or weakened, or you get a spider bite or a wound,
Right?
then the MRSA will travel to that wound and grow. So he could have been colonized with it,
Okay.
or he could have been contaminated.
Okay.
Because all a doctor has to do is go like this and touch you.
Oh, wow.
Or cough on you, or talk too close to you. They say most healthcare workers are probably colonized with MRSA. But if I talk to you, and you're immunocompromised in the hospital, you might pick it up from me. I have these old movies. I have an old movie that's exactly what it's about. The kid has cystic fibrosis, so he's immunocompromised, and he becomes colonized with MRSA. Well, now he's a threat to everyone else in the hospital, because immunocompromised people
immunized.
might
Yeah.
get droplets from him.
Exactly.
He lives with his sister, who's
Fine.
normal healthy, doesn't bother her at all. Yeah.
Okay.
But you never know. There have been a lot of what seem like healthy, strong people who have gotten it in the community, like football players. There's a football player who had to have his leg amputated, picked it up from the grass on the field.
Yeah, my husband was very athletic and very, very.
And in the locker rooms, like the wrestlers in high school, and
Community acquired MRSA.
yep, community
It's a
acquired
different-
MRSA.
Some other consider different, like,
Yeah, it's the same thing, you just get it not in the hospital, you get it
Killing
outside of the
away.
hospital. It can be really heinous, yeah. 'Cause that's the whole thing, if your immune system can't deal with it, it's very hard to get the right combination of drugs to get rid of it. think this goes with your pen.
It does, thank you.
Because I just burned out my black pen. All right, let's get these escape guys finished. Okay, Klebsiella pneumoniae. In fact, there is one in particular, CRKP. Hello, I can spell. Carbapenem resistant Klebsiella pneumoniae. And carbapenem is actually a whole family of antibiotics. And vancomycin is included in that family, depending on how you look at it. So this is another one can be resistant to vancomycin. The thing is, we relied on these kind of drugs to get these kinds of bacteria. What family is he in?
The
Enterobacteriaceae. There's a whole group of superbugs they call CREs. Carbamazepine resistant Enterobacteriaceae. So if you rely on this category of drugs to get your Enterobacteriaceae, and then they're resistant to it, that's a problem. And what do you think the A stands for? Good. Acinetobacter. And the species name would be Baumannii. They call this the Iraqi bacteria, or Iraqi bacteria, or whatever they call it. The Iraq bacteria.